Broadcast is now starting. All attendees are in listen-only mode.
Good morning and welcome. Before we get started, we want to let you know that this session is being recorded. By participating in this session, you are consenting to the recording, retention, and use of this session. During this session, your microphones are muted, so if you have a question, we encourage you to put it in the chat. The Department of Human Services is pleased to offer this training session for certified perinatal doulas wishing to enroll in the Pennsylvania Medical Assistance Medicaid program for participation in the managed care networks. We have several staff assisting with this training. My name is Sandy Migliarese, and I am the Division Director for Provider Enrollment. From our Deputy Secretary's office, we have Executive Assistants Lena Aletta, who will be monitoring the chat for any questions. Assisting Lena is our Bureau Director for Fee-for-Service, Michelle Robeson. Our trainers for today's session are Benita Bishop, Provider Enrollment Supervisor, and from our vendor, Gainwell Technologies, Provider Services Manager, Lana Elias. And Lana, I will turn it over to you.
Thank you, Sandy. I appreciate that. Well, I do want to welcome everyone to this morning's training on the Certified Doula Enrollment. What we're going to do is we're going to go over a PowerPoint presentation. I will do a portion of it, and then I will pass it over to Benita, who will go over the completion of the application. And then at the conclusion, we will open it up for some questions. So, Sandy, if you want to move to the next slide for me, please, I'd appreciate it. Our primary topics for this morning are going to be the Affordable Care Act overview, and then I will review what is a perinatal doula. We'll talk about the perinatal doula enrollment requirements and also how to access the enrollment application. Benita will go over the completion of the application, and then we will talk about resuming the application and also how, as a provider, you can check the status of an application once you've submitted it. And then we will go over some resources, and then at the conclusion, we will open it up for some questions. So moving forward, the Affordable Care Act. So the Code of Federal Regulations 42 does require that a provider must be enrolled in the Pennsylvania or the MA program, I should say, as a condition of being enrolled in a MA managed care network. So therefore, PA perinatal doulas who wish to participate as an MCO network provider to render services to MA beneficiaries under the MA managed care delivery system must be enrolled in the MA program. Additionally, the Affordable Care Act regulations do require states to revalidate the enrollment of their providers every 5 years. So therefore, a revalidation application must be completed and submitted every 5 years. Also, I do want to note that this training does not address MCO credentialing or contracting questions or concerns to the MCOs, so you would need to address it to them directly. So what is a perinatal doula? So perinatal doulas are trained professionals who provide non-medical support and guidance to pregnant individuals in various aspects, including reproductive health and family services. Now, perinatal doula services do include emotional, physical, and informational support and guidance, advocacy, education, and assist with connections to needed resources. Now, effective February 1st of 2020, 24 perinatal doulas may enroll in the medical assistance program to allow for them to participate in the managed care networks within the MA managed care delivery system. So requirements, certification, you need to have a current certification from the Pennsylvania Certification Board as a certified perinatal doula. And upon enrolling in the program, you would be a provider type 13, which is a non-traditional provider, and the specialty code assigned would be 130, which is certified doula. Now, accessing the application. So perinatal doulas, if wishing to enroll, will need to complete a new enrollment application. So to access the application, you will go to the landing page of the Promise portal, and the website address is there listed on the slide. Once on the landing page, you will select New Application from the provider enrollment section of the landing page, and then you will complete the application using your information and then submit it. And so this next slide here just shows the landing page and where you will find that new application in the provider enrollment section there. So once you click that, it'll open up the application for you. Now let's talk briefly about the application tracking number, or the ATN. So each online application is assigned a unique 10-digit application tracking number, or 10-digit number. It is imperative that you keep that number, because you will need that number in the future to re-access the application, or if you have questions on it and you contact enrollment, they will need that application tracking number. An email containing the 10-digit ATN will be sent to the email address entered in the contact information on the first page of the application, which is the request information page. So again, as I said, it's extremely important that you keep track of that number, and also that you provide a valid email address on the application. Additionally, that ATN number will display at the top of each page of the application. So you want to make sure that you take note of that ATN, as it is required for you to be able to resume the app, check the status, or if you call in to the enrollment lines, that they have the ATN, that they can research it for you. Now, throughout the enrollment process, providers will be sent email notices to the email address that is entered in the contact information field on the request information page of the application, which is that very first page. So the first email that would be received would be online application initiated, and that will be sent after completion of the request information page of which is page 1 of the application, and that has been completed, and then the provider does click the save and continue button. The next email that you might receive, online application submitted, that will be sent to you once the application has been completed and you have submitted it to the department. The online application returned to provider for revision email. So that's sent when a user's electronic application has gone to the enrollment staff for review, but's returned to the provider for some revision. The online application initiated expiring. So this particular email is going to be sent to you when the application is about to expire. So note that when you start an application, you have 30 calendar days from the date the application was started to complete it and submit it. And so this email will be sent to you when you have not yet submitted the application, normally sent on day 23, and this will allow you an additional 7 calendar days to go back to that application complete it and then submit it before it expires. And then finally, the online application return to provider expiring. So again, when a user's electronic application was previously returned for revision, a warning message is going to be sent when the application is about to expire, and that's what this email is all about. So as I said, you do have 30 calendar days from the date the application was returned to make the corrections and resubmit the application. So this email is going to be sent to you on day 23 if you've not yet resubmitted that returned application for revisions. And so then you'll have an additional 7 calendar days to update the application with any of the required information or changes, and then submit it before it expires. Okay, so that's where you will access the application. You will see those emails throughout the application process, and also you know about the ACA requirements. Are there any questions before I turn it over to Benita and she'll go over the enrollment application completion?
Hi, this is Lena. There are no questions in the chat right now.
Great, thank you so much. Then I will turn it over to Benita. Thank you.
Good morning, everyone. I am Benita Bishop, a Human Service Program Specialist Supervisor with Provider Enrollment. I will be helping you with the completion of the application. And as Lena already explained, when you go to our portal and you reach the landing page, you will select New Application. After you select the new application, this is the very next page you will see, which is Request Information page. On this page, you will be able to tell us exactly what you are applying for. If you look in the center of the top of the page, you will see program type, provider type, and enrollment type. The program type is Pennsylvania Medical Assistance, PAMA. Provider type, you are enrolling as a provider type 13 for a non-traditional provider. Your enrollment type will be an individual with a social security number. Next, you would enter your social security number and confirm it. Next, you would enter the enrollee's name, and this is the person who you are actually enrolling. If you are submitting the application for yourself, then you will enter your name here. If you are participating with Medicare, you will answer the question yes here. And then next you would enter your contact information. This is extremely important because if there are any issues with your application, this is the person that we will contact. So please make sure that your complete name, phone number, and the phone email is correct. When we send back the applications for revisions, everything is done electronic. So we must have the correct email information. So you can enter that, confirm it, and then press save and continue. Next, you have your service location address page. If you notice at the top left-hand corner, there's the red arrow that is pointing to the ATN, which is your application tracking number. This is the time when you need to write this information down. The reason for this is because, as Juan has explained before, if there's any issues, if you're not able to complete your application in one sitting and you want to save and come back at a later time, you must have your tracking number. You will not be able to enter the portal without it, access your application without it. If you have questions and you want to call Provider Enrollment Hotline, you need your tracking number. So please make sure that this is the time that you write this information down. Moving along the top of the page, next you will see the provider number. As you see, it is pending. You will not receive your provider number until your application has been approved. Next, you see the type of an application. So this is a new enrollment for a new service location. Then you have your start date. The start date is the date that you started your application. And the completion by is the date that you are to complete your application, not the date that the application will be approved. So this is the date. In this case, this application had to be submitted by the individual. Next, you will enter your your service location physical address. This is where you will make sure that all the information is correct, where your services will be rendered. We do not enroll PO boxes, so this should be a physical address. Another thing I want to mention is the zip code +4. Please make sure that you enter the +4 for the zip code. And that's very easy to look up. You can go online and you can enter your address for the business. You'll be able to locate that information. Next, we have our general and historical questions. These are just basic questions that we need. Some are for the exterior, interior entrance to the doorway. If you're a QHC, if you have related to Medicare, you would save and continue after that. The next slide, please. Next, we have the other addresses page. Now here, if your service location, if you want your information to be mailed to a different address, you have the option to choose so. We have the mail to, pay to, and home office. If you choose to have all your information mailed to the same address as your service location, you have the option to do that. Next, we have our specialty page. In this case, there's this one specialty for a perinatal doula, which is the specialty 130. You would list that here. You will also list your license, certification information, and as you see there, there's a drop-down arrow. You would choose the PA Certification Board. The state is for Pennsylvania. You would enter the number, your certificate number, and if your certificate number is alphanumeric, you must enter it exactly as it is listed on the certificate. Next, you will enter the issuing date along with the expiration date, and then save and continue. Here we have what we call the Provider Eligibility Program, which is also referenced as the PEP. Your PEP determines how you are paid. In this case, as far as all perinatal doulas, you would be enrolling, not paid. And this is because you're being enrolled for your MCOs, your managed care offices. So the only option for you to choose would be enrollment not paid. Also, above that, you have the requested effective date. If for any reason you need to have an effective date prior to your application date, this is where you would state that. You would choose yes to answer yes here. And because there's a paperclip, you will have to submit documentation why you're asking for a prior date. Normally, we do a back date of 60 days, but just make sure that you have some type of documentation, such as a claim, to verify the reason why you need a prior date to your submission date. And then you would save and continue. Here is your provider identification page. This information here is information we collect for your 1099. So this is your IRS legal information. You will enter the name and address where you want that 1099 mailed, and the contact person is the same. If there's a different person where you want to be contacted in reference to your 1099, then you would enter that information here. Again, I would stress that the name, phone number, and email information is very important. Under that, you have the individual, and here you will list your birth date, the gender, and your title or degree. That is optional. And then you save and continue. The additional information page, we are just collecting whether you have other languages, if you're able to speak other languages to your patient. If so, you will check yes, and then you'll be able to choose the language that you're able to speak to your patient. And you will save and continue. Next, we have a provider disclosure page. At the top there, before that, at the top there are definitions for an agent and a managing employee. Therefore, individual provider does not need an agent or a managing employee if they choose not to. But here's the reason, here are the definitions of what they are. An agent is just someone working on the behalf of the individual, and the managing employee is pretty much the same. It's just like a office manager. But these two are people who are working on behalf that can complete the application on behalf of the provider. The disclosure questions. Have you ever? These are questions that talk about any type of violation, any type of suspension, anything that was been revoked, any criminal offenses. These are the questions that must be disclosed by you or your managing employee. You will answer yes or no. Again, if you answer yes, you must disclose this information. So you must upload those documents into the portal so we may review it. And then you will save and continue. So here we're going to pause for questions.
Yep, we do have some questions. Let me bring those back up. The first one, is it possible to make the screen a little bigger? The second one, if you missed the 30-day window after revisions or updates needed to be made, would you have to re-enter the application all over again?
To answer that, the question is yes. If you missed the 30-day deadline, you would have to start a new application.
Okay. And then I did receive several questions about receiving these materials after the training. A copy of the training recording will be posted to the DHS website along with answers to any questions that were posted in the chat, and we can also distribute the PowerPoint presentation to you as well. There are two similar questions about being enrolled with an organization or a company. The first is, what is the application process for doula companies with multiple employees who are doulas? Is there a process for my company to apply on behalf of all employees? And the second similar question, is there a way to enroll as an organization and then have the doulas enroll under that entity, or is this per doula?
So the answer is yes. After this individual application, I will be going over a group application. So then I'll be able to answer all of those questions in a few seconds.
Thank you. There are a few more questions regarding business location. The first one is, what if we do not have a business location? Will clients see our home address? And the second similar question is, doulas usually don't work out of an office. We almost always provide our services in a birthing setting, like a hospital or in a client's home. Should we use our home address for the office section?
So Sandy, I'm gonna let you answer that question.
So for the service location, if you don't have a office separate from your home address would be what you would use, and the directory would display that address.
Okay. The next question is about one of the previous slides. It says, you said we need to enter a certification document. Would we upload our certification application through our certifying doula agency, such as DONA?
Your certificate is a copy of your certificate should be uploaded if that's what you're asking. As far as your board certification, it should be your board certification certificate. Is that what you're asking?
If I get clarification on the question, I will bring it up at a later time. For right now, that's all the questions that we have.
Okay, thank you. Sandy, are you able to make the screen a little larger?
I don't know if that helped or not. I can't. That's as large as I can make it.
And can you slide it over a little bit? It's a little off the page.
Yep. I cannot without shrinking it a little. Hold on. Ugh. Yeah, it's either big. I think this maybe is a better view, but.
Thank you. So here we have the ownership and control interest page. At the top of the page, you have your definitions. Again, you have the agent, the managing employee, significant business transaction, subcontractor, supplier, and a wholly owned supplier. In other words, under this, you will answer the questions as far as the managing employee or the agent. Does the individual petitioner have a managing employee? And as I stated earlier, individuals do not have or do not need a managing employee. So here you can answer yes or no. The others are the direct or indirect ownership. There is no ownership with an individual, so that is an automatic no. And then you will answer the criminal offense or any significant business transaction. I'm sorry, Sandy, I cannot see the bottom of the page. There we go. All right, and then you would save and continue. And here you have your attachment page. Now, throughout the application, anytime that there is a paper clip or you answer yes to a question, it is going to require you to upload documentation. In this application, we stated that that you had a certificate for the PA certification board. I'm sorry. So this is where you would upload here, preferably a PDF form of your certificate. And then it would list the title of your document here. And then you would save and continue. Now this is towards the end of the application. And this is called the Provider Agreement for Outpatient Providers. This is for the individual only. And this is stating that this individual agrees to all the laws, local, federal government laws, CMS laws, policies and regulations with provider enrollment or DHS. That you agree to disclose all information, whether it's a license or ownership, controlling ownership. And then you would enter your name at the bottom. This would be your digital signature and today's date, whatever date that might be, and you will save and continue.
Sorry, I'm trying to show.
Okay. I think we skipped a page. If we didn't do the last signature for the application. Okay, that's okay. With this page, there are 3 places where you should see the individual name here at the top. And then you see the second name at the bottom of this page. And then there's one more signature, and that signature is just certifying that you agree to everything that is stated, that everything is true and correct. And it will require that very last signature and date. And then you will save and continue. And then the next page will be your summary page for the application. And you'll get a complete printout of the whole application. When you submit the application, that is when you will receive your email stating that the application was submitted to DHS. The next slide, please. So now I'm going to go over the actual summary of that application so you can actually see exactly what it would look like once you have completed that application. Should we pause for any more questions here? Okay, so let's move on. Here you will see, this is considered like a paper application or the summary of the application that was submitted. At the top, you will see the provider and contact information. And if you remember at the beginning of the app, we had the program, provider, and enrollment type that is listed here with the provider's name. The social security number would be here. And then if you were Medicare participating, this will state here, yes or no. And then the contact information is listed. Next slide, please. You have your service location. As we stated, all information should be entered, especially the phone number and that email address. Next slide. Here's the, excuse me, your general and historical questions, where you will answer yes or no about the stairway for the exterior or interior steps, if you're at FQHC or Rural Health Clinic, or if you had any screenings in the last 12 months for Medicare. The other addresses, whether it's a home to, mail to, if it's separate from the service location, you can list that here. In this particular case, it was. The mail to address is different from the service location. Here we have your specialty. It is listed as the 13130, the certified doula. And here you have listed your license information, which is for your PA certification board, and your certificate number, the issuing and expiration date. The provider eligibility program shows you that you are enrolled, not paid, and that you did not, I'm sorry, excuse me, you did not ask for a back date or a date prior to the enrollment date. Here's the provider identification, that information that you would have listed for your 1099, the name and address, and then the contact person. And here I just want to state that we do not accept W-9s as verification of any tax document. The provider's identification continues with your birth date, the gender, and the title and degree, that is optional, the NPI number and taxonomy. Your additional information for languages is here, and also for fee assignments is here. And we'll talk about this in more in the group application. Here you have your provider disclosure questions. Those were the questions. Have you ever had any type of violation or criminal offenses? This information will be listed here. And again, I will state, anytime that you say yes to a question, that documentation must be uploaded in a PDF form. Okay. Additional, have you ever questions for licenses and offenses, any type of controlled substances? This information is listed here that you must disclose. The ownership, managing individuals. As we stated, individuals do not have to have a managing employee or agent. There is no ownership for individuals. And then you will just answer the questions for if you have any type of criminal offense or significant business transactions within the last 5 years. And towards the end of the application, you will see the attachments. And these would have been all the attachments that you uploaded into the application. Here we just had the one for your certificate, and it's listed here. Lastly, we have the provider agreement for the individual. And the name of the individual should be the one that's enrolling. If you do have a managing employee or someone that's completing the application on your behalf, please make sure that they enter your name here. So as an individual, the name should be for that individual being enrolled, because that's the contract between provider enrollment and the provider, not the provider enrollment and the person completing the application on behalf of that person. And here is that next section that I stated, where again, this would be the individual's name here and date, and you're just stating that everything is true and correct, and that you're responsible for any information that's submitted, that nothing, that there are no false statements. Okay, and that would be the end of the individual application. Should we pause for questions here before we transition to the group application?
There are a few more questions regarding the certification. Just requesting some clarification on the type of certification that will be accepted.
Sandy, would you like to answer that question?
Sure. So for medical assistants, we are looking for the PA certification board perinatal doula certification. There'll be more information in a bulletin that was actually issued today. But that at this time is the certification we are looking for.
One more question. Can you use an EIN number instead of a social security number to complete the application?
If your tax ID number for an individual is for that individual and not the group, the answer is yes. For example, if the individual name is Doula Smith, your tax ID number should be for Doula Smith. It should not be in a business name as an individual.
Thank you. That's all the questions for now.
Okay, great. So let's transition to the group application. This application has a lot of similarities, but it also have a lot of differences. Here, you will see at the beginning for the provider information, the information is the same. You have the provider type, program type, and enrollment type. You will choose Pennsylvania Medical Assistance, PAMA, the non-traditional provider 13. The enrollment type is group instead of individual this time. And here you will enter the group's name. Okay. Instead of the social security number, we will enter the tax ID number that is associated with the group. If the group is participating with Medicare, then you would answer yes. And then you would enter the contact information. This contact information is just as before. If there is an issue with the application, you need to know who to contact on behalf of the business for this app. So we will need the name, the phone number, and most certainly the email, correct email address. Then we will list the service location, just as we did before. And please make sure that you have the correct zip code +4. And as I stated before, you can Google that. It's easy to look up. You have your historical and general questions. Here we have information about mobile medical units that applies to you. I really don't think that would apply to a doula, but we also have the exterior and interior steps leading to the entrance doorway, and then if it's a rural or FQHC, you will answer yes or no. The other addresses, as before, you have the choice to change the addresses for your mail to, home, pay to, or home office addresses. If not, the addresses can remain the same as the service location. Your specialty is again 130 for the certified doula. Provider type 13 for non-traditional provider. The program eligibility program, the PEP, it's still the same, enrolled, not paid. Again, can you go back one, please? Again, if you choose to do the prior date, what we call a back date, you will answer here yes, and then upload the documentation while you're requiring the back date. Provider identification. This is your 1099 information again for the group. So you will enter the entity name and the address and the contact person for the group as well. And again, we do not accept W-9s for verification of tax ID. Now, with a group is listed in several ways. There can be a sole proprietorship. There can be a corporation for profit. There could be a corporation not for profit. This is where you will list this here. In this case, this is a corporation for profit. And then you have a question where you're asking if you are a DBA, doing business as. In this case, it's no. But if you are a DBA operating as a doing business as, you would answer yes. And then you will have to upload the documentation from Department of Corporations. Next, you will list your NPI number and your taxonomy according to CMS for doula. Again, we have additional information for the enrollment languages. What other languages do you speak to your staff? How do you communicate with your patients? Here we have tax exempt status. That would be yes or no. If you are a business such as a not-for-profit and you are claiming tax exempt status, you will say yes. Then you will be able to upload your documentation from the IRS. You know, your tax exempt status must be federal and not state, not from Pennsylvania. It must be from the IRS. So that documentation primarily will be a 501c3. Next, we have fee assignments. So with a group, you must have at least one person who is already enrolled with Medicaid. With Medicaid. This person will be listed here who is working for the business. Fee assignments are stating that the individual is allowing provider enrollment to forward their fees to their business. So in this case, you can have multiple people here listed as under fee assignments for your business. And that goes back to answering that question that we had previously. Again, we have the provider disclosure questions. Have you ever? Here, this is pertaining to not just the individual, but to the managing employee, agent, or anyone working, owners working for this business. It pertains to all. So you will answer yes or no. If yes, you will have to upload that documentation. Now, unlike individual enrollment, with a group enrollment, you must have a managing employee. So either managing employee or agent will be listed here. This information is collected as far as the name, their birth date, and social security number, along with their contact information. You will list their title here. This person is the managing employee. And then you will also answer the question, disclosure question for them as well. Now, ownership. With a group, ownership must be disclosed. The only owners that need to be disclosed for in the application are any individual or corporation that owns 5% or more direct or indirect ownership of that business. Here, if that is the case, you will say yes. For instance, if this was a sole proprietorship, of course you would enter that one individual that owns the business. You would enter all their information here, including their social security number. If there is a corporation, then you will enter that information in the next section under the corporation. If there are 4 individuals who own the business, you will list each individual as long as they have 5% or more direct or indirect ownership of that business. And as I stated, this is where you will list the percentage. And as you see here, it has direct or indirect. You would list, for the example that I gave, the 4 individuals, and let's say they each own 25% of the business. This is where you would enter the 25% direct ownership of that business. And then we have the other questions as relating to relationship of each ownership. At the top, you see the question for corporations. The same thing applies if this is a business owned by a corporation. Excuse me. The question states, do any corporate entities have at least 5% direct or direct ownership interest in the disclosing entity? You will answer yes if that is the case. And again, you would list only ownership that has 5% or more. If it is less, then no, you would not enter it. Under that, you have information in reference to the subcontractors and the ownership or control of interest of other entities. And this is only for the corporate portion of that. So this question that we just went over, this question is followed by questions regarding the subcontractor ownership. These questions are asking about the disclosed corporate owner and if they own other entities. After this section is completed, you will need to upload the verification documentation to be submitted in the application. Please note as you answer questions in the portal, as I stated before, any item that has a paperclip will require a document to be uploaded. All entity and individual provider applications will require a signature of a provider agreement. This agreement must be signed by the individual or the entity application. The signature must be from the individual for that organization. So as stated before, in the individual application, the individual has to sign the provider agreement. For a group application, anyone authorized on behalf of the business can sign the application. It does not have to be the owner. After the agreement and the application is signed, you will have the opportunity to review all the sections of the application prior to submitting it to provider enrollment. Please note all applications pass through automated checks that can take up to 15 days prior to us actually receiving it in the department. You cannot see applications or ATMs that have not been completed or submitted to us. So for an example, if you are working on an application and you have not submitted it, but you have questions and you call in, we are not able to see that application. We can only see applications that have been submitted to us. And that is the end of completing an application. Do we have any questions before we transition to?
Yes, there are some questions in the chat. The first one is, what is the reimbursement rates for visits and birth attendance? And this is a question we may need to circle back on.
Yeah, I mean, because you're enrolling for the ability to contract with the managed care organizations, we wouldn't be able to answer that question at this time.
Okay. Some questions around ownership. If you are the sole owner of an LLC but prefer to enroll under your business, do you enroll under the group even though there is one of you?
That is correct. If you are, yes, if you are a LLC, you are a corporation, so you would enroll as a group. And under the ownership and control section, you will list yourself as owning 100% of the business.
Thank you. Do groups need to hold off on their application until at least one employee has completed their application?
Yes, you need at least one person actively enrolled in PA Medicaid before you submit a group application.
Okay. Can we enroll as providers today, or do we have to wait until February 1st?
Yes, you can enroll today.
After the presentation and I turn it on, so don't try now. But within 30 minutes after this presentation, you should be able to access the application.
If you work for a nonprofit and have a doula program, but your doulas are independent contractors, group application.
I'm sorry, I didn't understand the question.
If you work for a nonprofit and have a doula program, but your doulas are independent contractors, can you fill out a group application?
So if the group application, you could, if you want, payments to be steered to your organization, or you could let those doulas bill for themselves. So it's really group applications are how your business works, not a preference by us.
Does the managing employee have to be a doula, or can it be a supervisor or financial compliance person at the organization?
A managing employee does not have to be a doula. It's anyone that you authorize to work on your behalf.
Is there a way to batch upload staff for the group application, or do you have to enter one staff person at a time answering all questions for each individual?
So, okay, Sandy, well, do you want to answer this? Because I'm not sure, is this where they would do the multiple applications or not?
So for every individual doula, we will need an application. When you're doing the group application, you have the ability to fee assign all of those doulas in one group application.
Okay. As a group, if you only have subcontractors that don't have ownership, would you need to add them to the application?
A subcontractor does not have to be an owner. So if they're working for the group, they can be added, just as Sandy just stated. They can be fee assigned to the group.
Okay. And last one for right now, is someone with a criminal background eligible to contract? Eligible to enroll, I think is what they meant.
Well, there are certain instances where you can submit your application, and once your information is reviewed, then it'll be determined.
Okay, there are lots of questions in the chat. We can continue with the presentation, and when there's time at the end, we can circle back to some of these questions, if that's okay.
That's fine. Ilana, I'm going to turn it over to you.
Thank you, Benita. So we're going to continue with how to resume or check enrollment application status. So to resume an application allows a provider to resume an app that has been started, but you've not yet submitted it, or resume an application that was returned to the provider for corrections. So what you need to resume an application is going to be that application tracking number, the FEIN or the SSN of the provider on the application, as well as the password that was created when you started the application. So to resume an application, you want to go to the landing page of the Promise portal. Again, the website address is on the screen. You will then want to select Resume Application from the Provider Enrollment section of the landing page. And then a link will open a window that will request the application tracking number. it will then request the tax ID or the SSN as well as the password. So once you supplied that information and it's been verified, then the provider can resume an application that has either not been submitted or resume an application that has been returned for corrections. And on our next slide or screen, you will see where you will, from the landing page, select resume application. And then once you select resume application, you will be entering in the application tracking number, the SSN or the FEIN of the provider on the application, as well as the password. Check the I'm not a robot, and then submit it. So that's why it's extremely important that you do keep track of that ATN, because you will need it to resume the application. Now, to check the status of an application, so this allows a provider to check the status of an existing application that you've submitted, or maybe it's incomplete. And again, the items that you need to check the application status are going to be the same as what you needed to resume. It is the application tracking number, the FEIN or the SSN of the provider who is on the application, and then the password that was created. So to check the status of the application, again, you want to go to the landing page of the Promise portal and select application status from that provider enrollment section. A link will then open requesting the ATN, the FEIN or SSN, as well as the password. Now, once supplied and verified, the provider can view the status of the current application. The provider can also view the application PDF if the application had been submitted from this page. So if you go to the next slide, you'll see where you select application status. And then you will be prompted to enter in the ATN as well as the FEIN or SSN of the application, as well as the password, and then check the I'm not a robot and hit search. You will then receive the application status summary section. It will again provide you with the application tracking number, the start date of the application, the date that you had submitted it, the status of the application, and then the status date. And then that's where the link is to download a PDF copy if you desire. And then you will notice if the application has been approved here that below we do provide you with the provider number and then the effective date of the enrollment as well as the revalidation date for you. So some resources. Well, any questions on the resume application or checking the status of the application?
None on that portion right now.
Great. Okay, so moving on to some available resources for the providers. We do have the link there at the top of the slide where you'll be able to access the enrollment application, also be able to access the resume or the application status links. There is information at the for providers on the provider enrollment information page, which includes requirements for each provider type. We also included the link for the provider enrollment and screening requirements of the Affordable Care Act. And that does include the most current information from the department relating to the ACA federally mandated regulations. So those Code of Federal Regulations 42 that we had on the previous slide, you'll be able to get those links at this location. And then also the Medicaid information, which provides information about the ACA federally mandated regulations and how they actually relate to the Medicaid program. The link to the Department of Human Services website, and on that site you will be able to find regulations, MA bulletins, provider quick tips, which is our next link there. Included that, it is the link on how to check the status of your electronic provider enrollment application. So that would be quick tip number 265. I also included the medical assistance bulletins. So I left X's there at the time we started the presentation. We were unsure of the bulletin number for doula enrollment, but if you want to make a change to the PowerPoint, it is MA Bulletin 13-24-01. It is available to you today, and you can find it at the What's New link on the DHS website. There is also another bulletin out there, 99-1610, which provides information on revalidation of providers or MA providers. Remember, I said that providers do need to revalidate every 5 years. So obviously 5 years in the future, you might want to come back to this MAB and get a refresher on that. And then finally, the DHS Provider Services Center. So their phone number would be that 800-537-8862, option 2, and then option 4 if you really needed to speak to someone in the enrollment unit. So that concludes the presentation for today, but we are going to open it up to some questions. So Lena, I'll turn it back over to you and let us know what our questions are. Thank you.
Thank you. We do have a couple more questions in the chat. A few of them I think are unique to individual circumstances. So to ensure that we provide a correct answer, we can follow up with them in the question answer form that will be posted to the DHS website. A couple of similar questions that we received. Can the doulas be part of both individual and group applications?
So all of the doulas will enroll as an individual, and then if they are working for a group or a number of groups, they can be fee assigned listed on those group applications.
Okay. Can you confirm that the provider type is 13? It does not have that option on promise.
Yes, it is 13 and it's not on promise yet because I haven't activated it, which I will do at the conclusion of this webinar.
What if you work as a doula for a company, but also have your own practice on the side? Does that affect anything? Can I still do a new provider application, and can they do the group application?
Yes, you can enroll as an individual. If it's your own business, you could make a group and enroll yourself as an individual, and then fee assign that individual to your own business as well as another business you work for. So it's really depends on your circumstances of how you operate.
Thank you, Sandy.
Okay.
Last
And
call for questions, if anyone would like to type those into the questions chat. A question about credentialing with managed care organizations. How does this work with managed care groups? Are we assigned to one or several? Many of us are new to this process.
This is Michelle. So you are enrolling for PA Medicaid at this time as enrolled not paid. When it comes to managed care, you'll need to work with each MCO that you want to work for and be credentialed through them. So anything related to managed care, you will need to work with each MCO that you want to work with. In addition, it's my understanding there will be a webinar with the MCO set up on January 25th. So all questions related to managed care, you should save them for that training. Again, I see some questions related about individual contracts with MCOs and reimbursement rates. Again, that is all through managed care. We do not have that information or can answer those questions.
last call for questions.
I'm not seeing anything new, Sandy.
Okay, well, then I want to thank you all for participating in today's session. We hope you found it helpful and informative. We will be posting this recording as well as the PowerPoint to the DHS website. And as I stated, we will be opening up the portal for applications in about 30 minutes. So I hope you all have a wonderful day and thank you for attending.